Hello, my name's Trip Gardner, and today we're here to talk about the fact that addiction is a brain disease. On the screen you see the cover of the National Geographic that depicted addiction as a new discovery in the brain. And the cover was printed in September of 2017. So you would think from that we've just figured out that addiction is a brain disease. The truth is, addiction was first written about as a brain disease in 1785 by Dr. Benjamin Rush, over 200 years ago. I think that until we accept that addiction really is a brain disease, we're going to continue to struggle in treating this disease. And that's what we're here to talk about today. So what is a disease? A disease is when an organ or a group of organs is not working the way they should. This may be due to the cells in the organ that form circuits not working correctly due to chemical problems or electrical problems, or a structural issue like a heart attack or stroke, something like that. The bottom picture shows a diseased heart here. And with this type of imaging, red means that the organ is functioning at the highest level of activity. Now, if you contrast that to the diseased heart, you see less activity. Here's your activity meter here. So this heart is functioning at a much lower level than it should. And we would all easily say that person has heart disease. Now, when we think about the brain, this picture is of a brain that does not have addiction. And we see in the frontal part of the brain here that the activity is fairly high. And then when we look at the brain of someone with this person has cocaine use disorder, for example, we see lower activity. So in the same way that we would easily call this heart disease, we should easily call this brain disease. So with addiction, it's a disease of abnormal brain circuits that direct memory, mood, your learning, your control of your behavior, your motivation, and reward. The disease starts out in the brain's survival pathway. This pathway drives us toward survival needs like eating, breathing, drinking water, and it does so through giving us a reward when we do those things. The reward is a chemical called dopamine, which makes us feel pleasure, so that we'll do it again and again. The brain learns to do these things in an automatic way, such that it's even hard to stop yourself. If I asked you to stop breathing, you probably wouldn't be able to do it, for example. And then little will get in the way. That's what happens when you eat, you breathe, or when you take something like oxycodone, for example. The slower part of the brain thinks, if we weren't stopped by the control center upstairs, then we must need it. So our learning center in our brain then learns everything there is to know about that thing that we seem to need to survive, whether it be food, water, or in this case, we can imagine that the brain did not get the message that we should not pursue something like oxycodone. And now, every time we encounter something that reminds us of using, we'll get a rush of dopamine through this learning process, which causes us to pursue that thing which this part of the brain thinks we need to survive. So now we start forming this lower loop outside of the control of our thinking center. It's as if the circuit has been unplugged. So we're driven toward that substance as if we have to have it to survive. As this goes on, the thinking part of the brain may get the picture that, oh my gosh, this is causing so many problems, we really have to put a stop to it. And that part of the brain will hit the brake, try to plug the circuit back in, but it will not be able to do that. The circuit is broken, essentially. So it can't break the behavior. No more than you and I would stop ourselves from trying to get out the door if we cut the oxygen off. So now our go center, much lower in the brain, is always thinking about how are we going to get the substance, because we have to have it to survive, like it's food or oxygen or water. One of the most important factors is, though, that food, oxygen, and water give us only a little bit of dopamine when we use them. The dopamine level in our body is at 100 at baseline. And when we eat something that's good, it goes up to like 150. The highest natural reward humans do is sex. And that gives us a reward of 200 on the dopamine meter. You can see here that things like cocaine, heroin and other opioids, and methamphetamine give much more dopamine than the human brain was intended to have to manage. This makes the decision for the stop center very difficult, particularly if that stop center is at risk for addiction, as we'll talk about later. One more factor is that the body adapts to the substance and will stop doing some of its internal processes because we're taking something that is replacing what we're doing inside. Then when we stop doing the outside substance, the body goes into this thing we call withdrawal. And withdrawal feels much like this fellow looks. Feels like you're on fire. This is another factor in motivating the survival pathway to get the substance. Because when we're sick, we know the next step from sick is death. So now we have two things driving us. So as time goes on, this disease gets deeper and deeper. What starts out as giving you pleasure turns into a situation where you're having to use just to feel normal. So at first we use, and we get this dopamine thing that we talked about. And that feels good, and we like it. It either gives us a pleasure we've never felt before, or it relieves a pain we've been carrying around for a long time in a way nothing else has. Or maybe both. Over time, the brain adapts, and so that we're no longer getting the same amount of dopamine rush as we were. It does this by taking the baseline dopamine level, which we learned in the previous slide was 100, and lowers it, say down to 75. That way when you use, you can't go as high. It's trying to protect you. However, addiction has figured that out. And it says, if you do that, I'll just use more. That's called tolerance. You get to the point here where even when you use, you don't even get back to normal pleasure. So you're no longer feeling as good as you even once did. And so on and so on. So at this point, you're just using to get as close as you can to your previous normal levels. So you're not even feeling good. You're feeling less sick every time you use. And that's driven by a different chemical called stress hormone. So what happens is it feels like you're in a tornado, or that you're auguring into a hole, going deeper and deeper. And what we see is that people will have difficult challenges like getting involved with the legal system, being in jail. They may lose their job. They may lose their housing. And as we've seen way too much in this current opioid epidemic, they may die. What this looks like in the brain is the area where we interpret pleasure that normally lights up red at the highest level. These are in brains that do not have addiction, will not light up now, even when not using. And it doesn't matter if the substance is cocaine or methamphetamine, which are both uppers, or alcohol or heroin, which are both downers. Either way, the pleasure center in the brain doesn't light up. So these are brains of someone with severe addiction. Now, if we had a picture of someone with obesity, it would look much the same. So food addiction looks much the same as other addictions. So how many people in the United States have addiction? About 19.7 million people, 20 million people, we'll say. Roughly the same as the number of people who have diabetes. However, this slide is a little misleading because it doesn't include the number 1 and number 2 addictions. Number 2 being nicotine, affecting almost 23% of the world, 16% of the country. Number 1, sugar, unhealthy foods like sugar. About 30% in the United States have obesity. So when you factor those things in, addiction is one of the most common of all primary care medical diseases. These people all have something in common. They all died from accidental opioid overdose. These pictures were depicted in a series from the Portland Press Herald called Lost. And you can see that these people could easily be you or me, our moms, our dads, our sisters, or brothers. In 2017, 418 people died in the state from what we thought to be accidental overdoses. That number increased from the previous year, which was 376. You can see here that what started out as being, these are pharmaceuticals in the orange, started out being an increased overdose death rate because of the pharmaceuticals has now been surpassed by the illicit drugs, which is heroin, and now on the streets, a lot of fentanyl or something called carfentanil. And there are other super fentanyls, as we call them. So what started out as pills, and still is, has to some extent been replaced by these much more dangerous opioids even. This is extremely dangerous stuff. And one of the things we should realize, when the person with opioid use disorder is using, they don't know exactly what they're getting. It's an unfair situation when you compare it to something like somebody with alcohol use disorder who will go and buy their alcohol in a store, and it'll tell them on the can or the bottle exactly what they're using. Not the case with the use of opioids on the street today. Very dangerous products. So how do we respond to the heroin epidemic? The first thing is we have to reduce the amount of prescribing that we do that's not indicated or irresponsible. The state has come a long way in that, perhaps one of the longest ways of any state. However, we still have a long way to go. Why do we need to do that? Because 75 to 80% of people who use heroin today, or fentanyl or carfentanil, started out with a prescription for pain pills. The second way is to reduce heroin addiction through the use of treatment, medication-assisted treatment. And this, in fact, has been the one way shown to reduce overdose deaths. Finally, we need to have the availability of a drug called naloxone widely scattered throughout the community. This drug will reverse heroin overdose and is easy to use. What puts your brain at risk for addiction? Biology and environment are roughly responsible for 50% of the risk of peace. The most important biology risk is, in terms of numbers, is genetics. Genetics being responsible for almost 50% of the risk in addiction. When we speak about environment, there's lots of factors, the most important of which are called ACEs, or adverse childhood experiences. Also very important is the age at which you first use, as we're going to talk about more. So primary risk factors are genetics, traumatic events, and early use of things like nicotine, alcohol, and marijuana. When we talk about genetics, there are multiple genetic factors. This one thing I'm depicting in this slide is a difference in the dopamine receptors in the pleasure center of the brain. And this is common to all addictions, as we've talked about before. These little green boxes represent the dopamine receptors in the pleasure center of the brain. So a receptor takes dopamine that's made in one cell and transferred to the next cell across this area in between, which we call a synapse, and when it hits the receptor, it turns it on. So if you have less dopamine receptors, as we see down here, than in this picture, then you will be able to receive less pleasure from the same event. So if both of these people went fishing, for example, this person would receive more natural pleasure than this person. This type of brain, in which we have 30 to 40% less of these dopamine receptors that turn on the pleasure, represents about 30% of us. So almost 1 in 3 of us, right off the bat, will be at risk for addiction. People with this setup will be more likely to pursue artificial ways to increase their dopamine, healthy or unhealthy, because they're not in the same place as these people. Other brain diseases also increase your risk. We've learned that addiction in the average in the population is around 1 out of 10 people. If you have any of these other brain diseases, schizophrenia, depression, bipolar, your chance of having addiction is much elevated. This has to do with common causes and risk factors, as well as people suffering symptoms in these other diseases here that increase the chance of them receiving a higher level of pleasure or less suffering from the drug, making the decision for the stop center harder because the benefit will be seen as more in those people. Early experimentation is a big risk factor for addiction. So most people will start using between the ages of, we'll say, 12 and 25. And they'll start with either tobacco, cannabis, or alcohol. So if you first started using at age 65, you would have less chance of becoming addicting. However, I don't want to be misleading, as one of the largest segments of our population increasing in opioid use disorder are people who are older, who may have been on pain pills for a long time, for example. So we see here smoking, alcohol drinking, and then again, starting at an early age greatly increases your risk. So why does that happen? One of the reasons is the brain is not fully developed until age 25. And the last part of your brain to develop is the frontal part, the top part, where the stop center is. Teenage years is a time in our life where we're really good at making brain circuits. We can make healthy ones, and we can also make unhealthy ones very good, which is why we see that most people with addiction have started in this time frame. This is the ideal time frame to develop addiction. Unfortunately, when we're talking about a disease that is a disease of brain circuits, this is also the best time for us to develop this. Now we're going to talk about the adverse childhood experiences. These are very important, and these include things like abuse, household challenges, like a mother being treated violently, mental illness, incarcerated household member, and neglect, either emotional or physical. It turns out that having any of these things increases your risk of having many chronic diseases, including obesity, diabetes, depression, heart disease, cancer, stroke, lung disease. In the case of addiction, if you have 5 or more of these 10 things listed here happen to you in childhood, you have a 10 times increased risk of addiction. Other things in the environment increase your risk for addiction. So much so that we know now that stress can even turn on genes. So even if you have a genetic system that wasn't expressing addiction, stress can change that system. Environmental factors include a lack of healthy coping skills. Modeling use. So if you see maybe your parents or people you look up to drinking to have a good time, or needing to use a chemical to relax, or when they've had a bad day, that is what you learn. As you get to be a teenager, you learn mainly from your peers. So if you have a network of peers that are using, you're much more likely to use no matter what your parents say. Having the drug available increases the risk. Community attitude about drugs and low expectations for people combined with low opportunity greatly increase risk. Addiction also increases the risk for addiction. Early exposure changes the brain, as we've talked about. That'll lead to the development of the addiction disease as the circuits change, And it's the same circuit for all addictions. So being addicted to nicotine is going to be the same circuit as if you were addicted to alcohol or heroin. The common pathway is nicotine first, to alcohol, marijuana, to illicit drugs. It's important to note that nicotine is as addicting as heroin and cocaine, and we could argue that nicotine is the most deadly of all these substances. So what does addiction look like? We'll talk about biologically first. So biologically, addiction wrecks you head to toe. There's no organ in the body that benefits from these substances. So another important point is we talked about the brain grows tolerant to the effects of the substance, but the body never does. So even if the brain grows tolerant to the effects of the, say, cocaine that you're using, the body does not. The damage continues at the same rate. How much damage is depicted in the pictures here? These were made by an artist from Los Angeles, and the artist took mug shots here and spliced them with shots of these people before addiction started. And it's clear from the pictures how addiction has affected these people psychologically. So the frontal part of the brain, where our behavior is controlled, has less activity. We looked at this picture earlier. So we see less activity here, so there's less braking. The stop center has less effect. So even if the stop center says don't use, there's less activity to stop the person from using. So the result of that is they can't consistently abstain from using. They may make it a day or 2 days. Even just challenging themselves like that would be a sign that they likely have addiction. So their behavioral control is impaired, and they'll likely do things that they would not normally do. People will crave it like they need it to survive, even though they'll realize they don't. They crave it in the same way we would crave food if we were starving. Consequences don't have the same effect that you would think they would have. So for a person who doesn't understand what addiction is like, it's hard for them to understand, how come you're still using? You lost your home or your job or your husband or your wife. Why would you still use? It's hard to understand that the part of the brain that will stop us when those adverse things happen is unable to stop us in this case, even if it wants to. We keep driving toward the substance. So it's frustrating for people when you don't understand that. One of the hard things is to realize that we're asking a person with addiction, a disease of the brain, to make decisions with the part of the body that has the disease. Finally, addiction disturbs your emotional functioning response. And what that looks like is depicted here. So this part of the brain is called the insula. And the insula is meant to respond to stressors, to give us extra oomph, energy, so that we can tackle the stressor. In this case, this center lights up much more than it should. So addiction changes the brain so that the insula will light up greater when it's faced with a stressor than it otherwise might. The other thing is that people with addiction may have spent 10 years on average before they come into treatment using. And much of that time they may have used addiction to get away from their emotions or bury their emotions. So they haven't been using their skills that they either had before or didn't have and would have developed if they had not had addiction. Socially, addiction causes one to be excluded from the group. One of the ways that our society has tried to help people with addiction is by excluding them from the group, hoping that that would be a punishment that would cause them to stop using. Unfortunately, the exclusion does not work because the brain is unable to stop itself even if it wants to. The other thing about exclusion is scientists have learned that there is nothing more stressful than being excluded from the rest of the pack. So not only does exclusion not help, it actually makes addiction worse. Other things we see are homelessness and joblessness and legal troubles increase. So spiritually, addiction causes us to go deeper and deeper inside ourselves, depicted by this circular staircase. To recover from addiction, it's critical that people come back up the staircase. Prevention and protection. So individually, people need strong social and problem-solving skills. So we must start teaching these things at a young level and continue throughout childhood and into adulthood. Families that are mutually involved in activities with their kids have a decreased risk of having addiction affect the family. Peers must have activities to do that don't involve substance use, activities that are fun. This could take the form of music, athletics, or a variety of other things. Schools and work places must have high expectations for all people, and there have to be opportunities to fulfill these expectations. The number one thing we could do to prevent and protect people from addiction is to reduce adverse childhood experiences. And these can be done in a variety of ways as depicted in the slide. Treatment. Essentially, treatment will break these addiction circuits by building new brain circuits which will protect us from the addiction circuit. The addiction circuit will not go away, and we have to spend a lot of effort to build new brain circuits that will wall off the disease circuit. It may take 6 months to 2 years or even longer to build these brain circuits. And then once they're built, we have to keep them flourishing because the disease circuit does not go away. And it can come back to dominate the brain in a matter of minutes. Medications work also by breaking the circuits. So no matter which of these treatments we pick, what we're really trying to do is to break the circuit and then build new brain circuits so that we can keep the disease circuit in check. We have to address all areas in order to do this: biological, psychological, social, and spiritual. If we don't, we will not be able to build the new circuits necessary to protect the brain from relapse. We also need to remember that no brain, no environment, no pathway to recovery is the same for anyone. Everyone has to have an individual treatment plan, and they also have to stick with it. This is a chronic disease, and like other chronic diseases, without following a recovery plan, will come back. We have to treat the other brain disorders, as we've explained, increase the risk. And it's important to note that treatment does not have to be voluntary, and that you do not have to get to rock bottom, no more so than you do with any other disease. Methadone and buprenorphine are medicines. They are monitored, and they are medicines that are used to treat opioid use disorder. These medicines allow patients to hold jobs, avoid crime, reduce exposure to disease, and engage in the counseling and the hard recovery work necessary to build the brain circuits we talked about. Wellness and recovery encompasses 4 pillars. 1, caring for your health holistically, having stable housing, strong community connectedness, and a healthy purpose. People on methadone and buprenorphine are able to pursue these things that will be necessary for long-term management of their addiction. One more drug we did not talk about is naltrexone. Naltrexone blocks the opioid receptors so that the effects of the opioids cannot be realized. These 3 medicines are all effective in treating opioid use disorder and all have a different place in the continuum of care. So how long should you be on meds? Much the same answer as you might give a patient with high blood pressure if they were to ask, how long do I have to take the high blood pressure pill? You'll need to take the medicine as long as the disease needs it to be managed. We don't know exactly how long that is for any one individual, and all individuals are different. One of the things we do know is that treating opioid use disorder without medications is less than 10% effective. Even in this study, where they gave people with opioid use disorder Suboxone, which is called buprenorphine naloxone, and took them off after 1 month, only 6.6% of people were able to stay off of the opioids, meaning that that's not a good way to treat opioid use disorder. When the people stayed on it for 3 months, depicted here, almost 50% were doing well after 3 months. Finally, in the 4th month, they took people off, and again, we showed that 4 months is not long enough. So tapering of the medications is unlikely to be effective until people have advanced in their health, community, housing, and purpose. That's the one thing that we're sure of. So tapering before these things have improved has not been successful. How well does treatment work? In general, 70 to 80% of people get better with treatment for addiction. That's just as good as other disease treatment, as depicted here, where we see diabetes, hypertension, asthma, and drug dependence all roughly at the same level of success. It's important to note that 25 million Americans are in recovery and doing well. Does the brain change with treatment? This is the healthy brain we showed before, with the red indicating the pleasure center getting pleasure. This is somebody with methamphetamine use disorder. After 1 month of not using, still no red. Same person 14 months later, the red is coming back. So recovery is possible even at this level. How well do people with recovery do? This is a large study, over 3,000 people, where a survey was sent out to ask people how they were doing in life after 10 years. And what we see is that employment increases over 50% in recovery. Volunteering increases 3 times. This level was actually 93% of people in long-term recovery volunteer, as compared to about 25% of the general population. Voting increases more than 80%. After 10 years, it's 96% compared to 58% in the last big national election. Owning own business, 39% after 10 years. So there's something about either the recovery process or the disease itself that when someone is in recovery, they tend to do better than the rest of people. It may be that biologically, people with addiction are better at establishing tribes, and this could lead to disease, but also can lead to more success. It may also be that the process of work of recovery would be helpful for anyone. And addiction gives people a pathway to do the recovery that makes them more successful than people without addiction. So recovery is possible. This picture here is someone with opioid use disorder and methamphetamine use disorder. And this is less than 1 year later in recovery. Recovery works.